Tomorrow I'll present this subject. What are the specific problems which are encountered when you treat patients in this area, which could be called tropical area. That means also in general less developed or intermediate developed countries. And therefore there are two aspects. The first is that in French Guiana I have studied the introduction of the screening of frailties, that means the G8. And we have observed several facts. I think that first it's a little, you must train a registered nurse to do that in the best way. It's possible. But in fact, in our example, we have 50 patients who were evaluated, and 46 had a G8 score 14 or less. That means that in fact it is not a discriminating tool. And you must in fact perform a simplified geriatric evaluation in any case. And there is another aspect. The reason is that in the G8 you ask the question, how do you consider your health status when compared to the other people of your age? And this doesn't mean anything in some populations. And may I explain what I mean? In French Guiana you have a very heterogeneous population because French metropolitan people are the minority. And you have there populations with different view of health, of disease or illness. These populations are maybe animist. They could be organized as a matrilineage system. They could consider health as strength and illness as some disturbance. Generally, illness is considered due to somebody who cast a spell. And they ask to the traditional doctor, and traditional doctor realized divinatory diagnosis. The treatment are different. They use plants. They use different rites. They use bath. And therefore their view of the disease is completely different. And this is true in French Guiana, but this is true also in immigrants in Western countries, either in West Europe or in North America. And however, this is true also in many countries in Africa and Asia. Therefore, this aspect, this cultural aspect is important. No, je me gratte le nez. Then, I think, in my experience, there are, you need to evaluate the geriatric assessment through comorbidity study, through dependence, through cultural aspects also. And the use of screening tool is quite unuseful. The second aspect of the presentation is what are the facts in less developed countries. And I think that there are two public health aspects. The first is that, however, this population is increasing, but elderly people population is increasing by far more than in Western countries. The second fact is that health expenditure is by far small when compared to Western countries. And how to proceed? There are different ideas which can develop. The first is a joint venture between northern centers in Western countries and southern centers. And the objective being to train doctors, and maybe in geriatric oncology, to prepare decision trees which are aimed to allow the less to use the less expensive treatment, but the higher activity. So to have a good rationalization of the expenses. And in this way, a third idea is important to develop centers of excellence in this country. Maybe one center of excellence. And through this center, other doctors, nurses are trained and can take in charge the patient. There is another aspect, which is the therapeutical aspect. And we must remember that in less developed countries, the most active curative treatment remains surgery. Then, the most active palliative treatment and cheaper treatment is radiotherapy. And finally, that palliative care and mainly pain treatment is one maybe the most important aspect. And in this way, the fourth treatment, which is the medical treatment, and generally somewhat expensive. And there are, at this moment, programs which are organized by institutions, by industry, to allow access to the most active medical treatment in these countries. And I think that we are just at the beginning of the development of geriatric oncology in less developed countries, but really it's an important problem. It is possible to develop some activities or some managements which could help a lot, a big proportion of these patients.